We're now going to have our special keynote address, and the speaker is Dr. Joe Schwarcz, who is the director of the Office for Science and Society at McGill University. Dr. Joe earned a PhD in chemistry from McGill, and now he has a column in the Montreal Gazette and a radio show on CJAD, educating the public about science and pseudoscience. He's a prominent member of the community and doing very good work in terms of trying to promote the use of science in formulating public policy. Today he's going to talk to us a little bit about who we should listen to when making public policy, and maybe talk a little bit about pesticides and some other important issues. And please join me in welcoming Dr. Joe.
Thank you. Thanks very much. Our office here at McGill is a rather unique undertaking, with a mandate of demystifying science for the public, obviously for our students as well, and casting light into the scientific darkness that is kind of becoming, pretty pervasive in the world today. So we try to clear up a lot of confusing information out there without any conflict of interest. And I think this is something that needs to be mentioned because we make our decisions purely based on scientific methodology. It makes no difference to me or to my colleagues whether or not any chemical or any process is regulated or not. What makes a difference is whether or not those regulations are arrived at through scientific methodology rather than hearsay or they say or emotion. So we really have allegiance only to the scientific method. We kind of worship at the altar of peer-reviewed research. Of course, cognizant of the fact that not everything in the peer-reviewed literature is absolutely certain. We have, of course, many cases where errors have creeped in. We have the fraudulent case of Andrew Wakefield and his research connecting autism to vaccination, which is, of course, total nonsense, and yet that was published in The Lancet. So we have to be cognizant of that. We go by the evidence. Evidence is not always easy to come by because, of course, there are various degrees of evidence. But we try to lace everything together and come to some sort of consensus on scientific information. The extent of scientific illiteracy out there today is unfortunately rampant. People are inhaling aerobic oxygen or putting it drop-wise into their water, hoping to energize themselves. Total absurdity. All you have in there is a few milligrams of potassium chlorate to justify the presence of oxygen. But of course, as most of you are aware, we breathe through our lungs, not through our tummies, and therefore it doesn't help to do to put any kind of oxygen into the stomach. Not that this would contain any significant amount anyway. If not that, then people will resort to dehydrated water, and it's really quite amazing that you can sell such things to the public. But you can. You can get droves of people signing petitions to ban dihydrogen monoxide because it's found in tumors, it's found in pesticide solutions, it's found in fire suppression equipment, it's found in automobile radiators, and obviously dihydrogen monoxide is just water. But that's a testimonial to the fantastic degree of scientific illiteracy out there. People want a chemical-free life. They want to bring their children up in a chemical-free world. Well, the fact, of course, is that if you are buying something that's chemical-free, you are not getting a very good deal, because the only thing that's chemical-free, of course, is a vacuum. Everything in the world, obviously, is made up of chemicals, and if you see something that is marketed as chemical-free, as I said, basically, you are getting absolutely nothing. In England, they have a prize of £1 million that they are offering to anyone who can come up with a true chemical-free product. I think it's a pretty safe bet that that money will never have to be paid out. The fact is that chemicals are not to be feared, they're not to be worshipped, they are to be understood. But that understanding isn't always simple. There's a tremendous amount of quackery out there. When I bring up the term quackery, people think of the heyday of the snake oil salesman. And of course, that it wasn't so long ago. We go back about 100 years, and snake oil was quite a popular remedy. Why? Because it was believed that snakes never suffered from arthritis. They were very supple and curved all over the place. And it was believed that if you could isolate whatever lubricated them on the inside and use it in humans, that would be a solution to arthritis. Today, of course, we use the expression snake oil to designate anything that really doesn't work, because the original snake oil obviously had no effect other than the placebo effect. But you know what? That isn't a bygone era. It is unfortunately still with us today. We have all kinds of nonsense being promoted, unfortunately, sometimes in a very serious way. This book claims to have the cure for all cancers, so of course it's understandable that it has sold millions of copies. Yet it has no scientific validity whatsoever. We have people like Kevin Trudeau plying the airwaves with their infomercials, selling everything from memory tapes to coral calcium to miraculous dietary supplements, and making millions and millions and millions on these infomercials. Sometimes there is justice in the world, and Trudeau may be sniffing that one because he has been fined $37 million in the US by the Federal Trade Commission, basically for promoting nonsense, including the natural cures that they don't want you to know about, that they, of course, being the scientific establishment, you know, of course, in collusion with government to undermine the health of the public. He has been arrested because he claims not to have the $37 million, and he has been, he's going to be put on trial starting in November, and if he doesn't come up with the $37 million in fine, he'll be trading in his immaculately made suits, business suits, for some nice orange garb. And hopefully that will work out the right way, because he deserves basically to be jailed for life for having disrupted the lives of many, many desperate people. So who do we listen to? That is really the question that we want to address here today, because there's so many opinions out there, and of course they tend to be dissenting. Let me give you a couple of examples. Bisphenol A, or BPA, perhaps the most widely talked about chemical in the lay press these days. And it's a very, very interesting chemical. It is used in the making of plastic called polycarbonate. That's what hockey helmets are made of. We use polycarbonate to make compact discs. This plastic is used in the glass, the polycarbonate carboys that sit on top of water coolers. It's used to make fillings. People are concerned about amalgam fillings and having them replaced by so-called white fillings, which are made with bisphenol A, about which we probably know less than amalgam. The ink that is used in cash receipts is made with BPA, and the world is held together with glue. And that epoxy glue is made with a resin that is formulated with BPA. So it's everywhere. The lining of food cans is made of epoxy resin to make sure that the food does not interact with the metal of the can. It isn't surprising, therefore, that we find BPA virtually everywhere, including in our urine. If we assayed every single one of our urines here, we would find bisphenol A. Of course, we could find 100,000 other chemicals as well if we chose to look for them. Today, we have fantastic analytical capabilities. And I constantly remind my analytical chemist colleagues that they really are the root of all of our problems these days, because now they can find things down to parts per trillion. That's 1 second in 32,000 years. That's not finding a needle in a haystack, that's finding a needle in a world full of haystacks. But the fact is that just because something is there, just because a chemical is present, doesn't mean that it is harmful. The presence of a chemical does not equate with the presence of risk. It just equates with the tremendous ability that analytical chemists have developed to find things. Of course, neither does it mean that it is harmless. And in the case of molecules like bisphenol A, certainly we need to look into the matter because they fall into the category of what we call endocrine disruptors. Endocrine disruptors are chemicals that have hormone-like activity. And any substance that has hormone-like activity has to be scrutinized because hormones are active in our body in minute levels. Our pituitary gland, for example, puts out less than a microgram of hormones every day, and without that, there would be no life. So when we are confronted by so-called endocrine disruptors in the environment, even though they are present to very, very small extents, it doesn't mean that they are harmless. We do need to take a look. But who are we going to listen to when that look is taken? There are all kinds of activists, alarmists out there who will tell us that bisphenol A is the chemical from hell and it is going to do us in, and that it was concocted by some nefarious chemists who are somehow bent on undermining our everyday existence. So do we listen to those kind of alarmists who tell us that virtually every disease known to mankind has been linked with bisphenol A? Here are just some of them. Or do we look at the regulatory agencies? There are numerous regulatory agencies around the world. Of course, virtually every country has some. And these are staffed by knowledgeable people. The European Food Safety Agency, for example, has toxicologists, has chemists, has biologists, has physicians who look at scientific issues, particularly as it relates to food. And they evaluate concerns, such as the finding of trace amounts of bisphenol A in our food supply. They look at all of those things, and they write position papers on it. They come up with policies that are then recommended to governments. Well, the European Food Safety Agency has been looking at bisphenol A now for decades, and their most recent finding is that this chemical, in fact, occurs in the environment to a smaller extent than we used to think. Now, this is the cohesive work of hundreds of scientists, not some rogue wolf crying in the wilderness. People like Mike Adams, who runs the website that I just showed you, Natural News, who has absolutely no scientific background and is totally incapable of evaluating scientific information. Or Joe Mercola, who's an osteopath and has the world's most popular health website, incredibly, since most of the stuff that is on there is absolute nonsense. So do we listen to those alarmists who get a lot of press, because the press, of course, loves stories like that? I mean, let's face it, dog bites man is not a story, but man bites dog is. So you get all of the alarmist stories. Well, we like to look at what the regulatory agencies come up with. The National Toxicological Program in the US has also looked at bisphenol A. FDA has looked at it. And they come to the conclusion that whatever risks there are very small. No agency ever comes to a conclusion about anything that there's no risk at all, because that would be unreasonable. Life is full of risks. You came here today and you took a risk because you know that there are car accidents and things can happen. But you evaluated the risk, not consciously, and the evaluation was that it was worth coming here because the benefits outweighed the risks. That's what we do in every kind of issue. Here, locally, of course, we look to Health Canada. Health Canada has looked at bisphenol A extensively. And as you know, we were one of the first countries in the world to ban baby bottles that were made of polycarbonate, because we exercise what is called the precautionary principle. Precautionary principle suggests that you don't have to have absolute evidence before you take action, as long as there are substitutes that are equally good. And in the case of BPA, that was the instance, because there are all kinds of other plastics that can be used for baby bottles. We can use glass bottles, so it was an easy substitution. However, you also have to be careful in applying the precautionary principle. You have to apply the precautionary principle to applying the precautionary principle, because not everything can be readily substituted for. And the devil you know may be better than the devil that you don't know. And that's why we put our faith in the regulatory agencies because they have enough experts to evaluate all aspects of the situation. Similarly, for other chemicals that you may have heard about, the phthalates. These are very interesting substances. Phthalates are added to plastics, particularly to PVC, polyvinyl chloride, in order to soften them. If you remember records, some of you I suspect will remember them. These were these black discs that we used to put on this thing called a turntable, and a needle would bounce up and down as it turned around, and music would come out of those gigantic boxes in the corner of the room. Well, that was made of PVC, polyvinyl chloride, but your shower curtain is also made of polyvinyl chloride, and it's roughly the same thickness. So how can this be? Well, it can be because the shower curtain has some phthalates added. Those are not chemically bound to the polymer. They are just dissolved in the polymer, and in fact, they can leach out. Why should this be a concern? Well, because phthalates also have endocrine disruptive properties, and we are exposed to them, not only from playing records. Many of our cosmetics, perfumes, for example, contain phthalates because they retard the rate at which the smell evaporates. Phthalates are present in a number of plastic products that we use on a daily basis. And there are, you look around the world, these kind of plastics are everywhere. Sexual items, they're made of PVC. People are worried that phthalates are going to be absorbed into their system from using these. So it's a very interesting story, and there's a movement to try to get rid of these phthalates in the environment because, like bisphenol A, they have hormone-disrupting properties. Well, these hormone-disrupting properties are well studied and are well known, and governments take action. Here, of course, again, we look to the policies of Health Canada. Researchers have looked at all of the evidence and have come to the conclusion that there are instances where we should be careful with the use of phthalates. Where children might be exposed to inordinate amounts, you want to take care, and not all phthalates are identical in their chemical and physical properties. There are some that are more worrisome than others. So we do have regulations that have been instituted about which phthalates can be used under what conditions. However, if you look at the alarmist literature, they, of course, will tell you that our health is being undermined by the existence of phthalates in the environment. PETA is a prime example. PETA is the acronym for the People for the Ethical Treatment of Animals. And the word ethical should be used very, very loosely here. And I'll tell you a little story about this. I've had objections to PETA and some of their antics for many, many years. I fully understand that there are issues with animals. I've certainly seen some poultry farms that are just unacceptable in the way that the animals are treated. There have been instances where research animals have not been treated properly. And of course, one can even question the whole philosophy of raising animals and killing them just so we can eat them. So there are some arguments to be made, but PETA makes them in ridiculous ways. And I don't think that promoting nonsense is ever sensible, no matter what the end is. PETA will argue that the ends justify the means. You may have seen some of their posters where they give you, on one side of the poster, chickens in a cage. On the other side, they give you Auschwitz victims, and they say that they are identical. This, to me, is highly objectionable, but they argue that sometimes you have to go to extremes to get the pendulum to swing back. Well, I think they went to an extreme a couple of weeks ago when there was a buffalo wing eating festival in Buffalo, New York. And I'm not certainly partial to these crazy eating festivals, the hot dog eating contest, the chicken wing eating contest, not at all. But I am partial to good science. And I certainly object when science is derailed, as PETA did in this case. They had huge posters and television and radio ads suggesting that pregnant women should be warned not to take part in the chicken wing eating contest because they would increase the risk of giving birth to children, to boys with smaller penises. So they associated the chicken wings with the smaller penises, based upon the fact that studies have shown that when urine from pregnant women is analyzed for phthalate content, and then you measure the size of the penis of their offspring, it tends to be shorter if they had a lot of phthalates in their blood. This was one study carried out by Shauna Swan, University of Rochester. It got a lot of publicity. As you can imagine, penises do that. They get attention. And so the lay press, of course, was all over that one. That study was never duplicated, ever. And as you know, the first thing we ask for in any kind of scientific study is replication. We don't pay any serious attention to it until we know that the study can be duplicated. So here's what PETA said, that there's a study out there that links the chemical phthalate to shorter penises. And then they said, look, if we analyze chickens, we find that phthalates are also present in chicken, which is true. You have trace amounts of phthalates that are present in chicken. In fact, you can probably find them in everything because plastic wrap may have leached. The gloves that are used by workers may have been in contact with the meat. Of course, they're there in trace amounts, but we can find those trace amounts. So here was the PETA argument. Phthalates in pregnant urine are associated with a smaller penis. Poultry contains phthalates, therefore eating poultry leads to a smaller penis. And this is really what they had on their posters, on their radio ads, on their television ads. I hope that most of you realize that this is not only scientific nonsense, but it is also a logical fallacy. This would be like suggesting that alcohol is associated with strange behavior, which it is. Rum cake contains alcohol, and therefore eating rum cake leads to strange behavior. Everyone would recognize that this is just an absurd statement, and yet what they are saying about the chicken wings and the phthalates amounts to the same thing. Of course, they will argue that even if it doesn't make scientific sense, they're using it as an extreme example to get people to understand that animals should not be abused. Well, animals, of course, should not be abused. And there are good, valid scientific arguments that can be made. You don't have to resort to this kind of nonsense. We have similar issues with pesticides. Now, pesticides, of course, are designed to kill, obviously. And there are legitimate concerns with pesticides. We have a problem with bees, a phenomenon called colony collapse disorder. Bee populations are, in some cases, disappearing, and the fact is nobody knows why. And some have suggested that it has to do with pesticides. Perhaps it is being looked into. But in general, pesticides by the general public are looked upon with scorn. In some cases, of course, justifiably, because pesticides obviously are designed to kill. But just because they are designed to kill doesn't mean that trace exposure in humans is a real issue. But once again, where do we look to have proper policy on how these things should be used? The Pesticide Management Regulatory Agency in Canada is the focal point of pesticide regulation. This is not a handful of people. This agency employs 300 scientists with extensive backgrounds in toxicology, physiology, chemistry, biology, medicine. And they peruse all of the information pertinent to pesticides before allowing them on the market. The amount of documentation that's required is just amazing. I'll give you an example. What you're looking at here is the documentation that had to be provided by one company when they wanted to put one pesticide on the market. All of that is full of studies on animals, in vitro, studies, human exposure, epidemiological evidence, all of that submitted. based on that data, the government comes to some policy on whether or not the pesticide should be allowed. Is it a perfect system? No. There is no perfect system because we're always gaining more knowledge. And it certainly is possible that in spite of all the scrutinizing of the evidence, when some chemical is used on a large scale, you find some issues that didn't crop up before. And then you make adjustments. But once again, I think we need to rely on the experts, not on the hearsay of people who are making their arguments purely based upon emotion. Now, I want to leave you with one final idea here, which I think is extremely pertinent and should be paid attention to. Homeopathy is a very, very curious practice. I suspect that most of you have heard the term and know something about it. But I can tell you from having been in this business for many years, having done numerous surveys, the vast majority of the public, educated or not, does not really know what homeopathy is, nevertheless will have all kinds of opinions on it. This includes physicians. We've done surveys, and it's pitiful how few physicians actually know what homeopathy is. When you do these surveys, you get answers, oh, it's natural medicine, it's alternative medicine, it's whenever you use herbs, it's acupuncture, all of these things. No, homeopathy is not that. Homeopathy is not herbal medicine. Homeopathy is not the use of acupuncture, it's not the use of reflexology, it's not a grab bag of every alternative treatment that is out there. Homeopathy is one specific practice which was invented over 200 years ago by Samuel Hahnemann, a German physician. And this practice has been a blight on the face of science for now over 200 years. Samuel Hahnemann was a good man. He was a medical doctor. He had learned in medical school whatever you learned in those days, which was basically how to purge patients, how to bleed patients. Indeed, if you got better, it was usually in spite of the doctor, not because of the doctor. He wanted to find something better, kinder, gentler therapy. Well, in those days, malaria, of course, was a devastating disease, as it still is today. And the only therapy was cinchona bark, a bark of a tree that was found in South America. However, of course, it was a crude extract that they were using in those days to treat malaria, and nobody really knew how much you had to give a patient. So Hahnemann decided to be his own guinea pig, which they did in those days. This was before any ethics committees. And he wanted to see how much he could stand in terms of dosage, because he didn't want to overdose his patients. So he started taking increasing amounts of cinchona bark and eventually developed a fever, which to him seemed like exactly the same symptom that he saw in his patients who were being treated for malaria. So he hatched the basic tenet of homeopathy, that a substance that in a sick person cures a disease is the same substance that in a healthy person can cause those symptoms. This makes no scientific sense whatsoever, but this was the basis of homeopathy, like cures like. So it was all based on Peruvian bark and the symptoms that it would provoke in a person who was healthy. Now, it turns out that as ridiculous as the original tenet of homeopathy was, it was even wrong in its own context, because no one ever since that time has ever shown that increased doses of cinchona cause a fever. So Hahnemann developed a fever for some totally unrelated reason. All right, well, never mind the fact that it had no scientific basis. He didn't understand that quinine was the active ingredient in cinchona bark. Of course, they didn't know enough chemistry in those days. But he nevertheless came to the conclusion that whatever was present in cinchona bark could cure the disease in sick people because it caused the same symptoms in a healthy person. So everything in homeopathy really is based on this idea that he got the fever from cinchona bark, which, as we know, can never be duplicated because cinchona bark does not do that. In any case, he then went on to do some more so-called provings, whereby he would give his friends or his relatives increasing amounts of substances to see what symptoms they would provoke so that he could use those substances in a diluted version to try to treat sick people. For example, he would give his friends and relatives arsenic, and he would eventually discover that it caused gastric pain, vomiting, and diarrhea, and therefore a diluted dose of arsenic would lead to the treatment of food poisoning. It was not a good thing to be Hahnemann's friend or relative in those days. And based upon these experiments, he developed the whole homeopathic pharmacopoeia, which then took a different turn. He introduced the law of infinitesimals. Because he knew that he was treating his sick patients with smaller doses of the substance than caused the symptoms in a healthy person, he concluded that the less you give to a patient, the more effective it is. And that, of course, is just as ridiculous as it sounds. It flies in the face of everything we know about chemistry, biology, physics, and toxicology. But as if that weren't enough, one day he went to see a patient because they made house calls in those days, and he took a carriage on cobblestone streets. And he found that when he administered his homeopathic remedy to that patient, the patient got better faster than he had ever experienced before. And he concluded that it must have been the shaking because of driving on the cobblestones that did this. So he introduced the second principle of homeopathy, which is succussion. And that is that when you dilute your original solution, you must succuss it, that is, you must beat it against a leather pillow, and that will potentiate it. So that's the principle of succussion, which of course makes no scientific sense whatsoever. So here's what homeopaths do. They take the so-called mother tincture, which produces a symptom in a healthy person, and then they begin a series of sequential dilutions to the extent that there's not a single molecule of the original left, even forgetting the fact that the original had nothing to do with curing anything. But at 12C, there isn't a single molecule of the original left, having diluted something 100 times, 12 times. Just to give you an idea, at a 30C dilution, which is the most potent one that homeopaths use, because the more dilute, the more potent it becomes, as you can see, there is nothing there. It is totally unreasonable. So the basic tenets of homeopathy make no sense. However, just because the basic tenets make no sense is no reason to throw it out. That's not the way we work in science, because maybe there is some other mysterious way that these solutions work. These days, of course, homeopaths have us chemists breathing down their neck and saying, look, there's not a single molecule there. How can you claim it does anything? They will say, well, no, there's not a molecule, but all of this diluting and beating against a leather pillow has left an imprint of the original molecule on the water. Well, of course, this is total nonsense. Water does not have any ghostly images hidden in it. But even if it did, why would one assume that that has anything to do with any curative property? So it's just silliness. But even though it's silly, it's not enough to throw it out. The reason that we can throw it out is because it has been extensively studied. And we have meta-analyses published in proper scientific journals which have looked at all of the trials that have been carried out on homeopathy. And there have been many, most of them, of course, done by homeopaths, but many trials have been carried out. And there just is nothing there other than the placebo effect, just as one would expect. The Cochrane collaboration, one of the most reputable organizations in the world to do scientific studies, has also come to the conclusion that whatever effect homeopathy has is really the placebo effect. Now, there's nothing wrong with the placebo effect. It works 30 to 40% of the cases. That's fine. And I don't have anything against homeopathy as long as a homeopath would not make unscientific statements about actual curing aside from the placebo effect. When you confront the homeopaths, they will tell you that the reason that scientists cannot find any effect is because homeopathy, in fact, cannot be subjected to trials. It works in some other way. Well, any kind of health claim can be subjected to medical trials, and we have done that. And homeopathy has come up lacking. Interesting enough, different homeopaths have different remedies for the same patient, which is also an example of just nonsense. In Britain, they've concluded that homeopathy makes no sense. Recommendation to take it off the National Health Service. Incredibly, they had it on the National Health Service. There's a lot of opposition. People like bunk. And finally, here in Canada, believe it or not, we have a policy where the Natural Health Products Directorate assigns homeopathic products a DIN number, a drug identification number. The only proviso is that they have to prove it's safe. Of course it's safe, because it contains nothing. There is no requirement whatsoever to prove efficacy. And yet Health Canada gives this a DIN number. This is a national shame, because what it says to the public is that this is a safe and effective drug. That's what approval by a regulatory agency means. This is the wrong policy. This is quackery disguised as science. Finally, I leave you with one message. If you're interested in this kind of stuff, debunking the nonsense, the Laurent Trottier Public Science Symposium is one of McGill's premier events. And it's an annual event. It runs for 2 days. We have 2 sets of lectures, 5:30 on Monday, October 28th, Tuesday, October 29th. And we have 4 incredible speakers coming. It's going to be at the Centre Mont-Royal, which is just across the street in Sherbrooke. If you ever heard of Michael Spector, who's the featured writer for The New Yorker, he wrote that wonderful article on Dr. Oz, and I suspect he will take a few stripes off of him. We have Eugenia Scott coming, very, very notable scientist who will talk on evolution. John Ioannidis is a medical doctor who claims that 50% of all published literature is wrong. So he's going to be very interesting to listen to. So 5:30 on the 28th and 29th, I think you would really enjoy it. So thanks very much for your attention, and hopefully I've been able to give you perhaps somewhat of a different view on policy and who we should listen to and who not.